Hello everyone. It is 1 year before 2024 and I would like to wish us a Happy New Year in advance. Hello, I am Delcher Jain. I am from University Malaysia Sabah, a year 1 medical student. And today I would like to share with us a title of my self-study module, which is the cardiologist and the cardiovascular system. This is about the medical specialty that I am interested in. Who are cardiologists? What are they? Cardiologists are doctors or medical specialists that treat diseases related to the heart or any abnormalities related to the heart. Well, I am from Sabah, Malaysia. There's a well-known cardiologist in Malaysia. His name is Dr. Hendrik Cha Miayang. He has 30 years of experience as a medical doctor and also a cardiologist. And he had won awards such as Distinction Viva in Physiology 1984 and also Association of King's College London in 1987. The list of treatment that Dr. Hendrik offers is arrhythmia treatment with ablation and pacemakers. Secondly, he also offers coronary artery surgery, and then congestive heart failure treatment, and finally, he also offers cardiac OPD procedures to his patient. We're going to dive deeper into the anatomy of cardiovascular system. So we are going to be talking about the structure of the heart. So do you know that the heart is divided into the left part and the right part? The heart has 4 chambers: the left atrium, left ventricle, right atrium, and also right ventricle. Each chamber of the heart has a special function. And also, the heart has 3 great vessels. So, they are the pulmonary trunk, the aortic arch, and also the superior vena cava. The pulmonary trunk, it will branch into right pulmonary artery and also left pulmonary artery. And how about the aorta? It will branch into 3 smaller arteries, which are the brachiocephalic trunk, the left common carotid artery, and also the left subclavian artery. And brachiocephalic trunk will further branch into right subclavian artery and the right common carotid artery. So here there are 2 views, which are the anterior view and the posterior view of the heart. So we can see here the left atrium is connected to the pulmonary veins. And how about the aorta? The aorta is somehow connected to the left ventricle of the heart. So this means the aorta will drain blood from the left ventricle of the heart. And how about superior vena cava and inferior vena cava? They are connected to the right atrium of the heart. They will bring blood into the right atrium. And finally, the pulmonary trunk, it is connected to the right ventricle of the heart. So this means that the pulmonary trunk will drain blood from the right ventricle. The coronary artery, it is important to supply oxygenated blood to the heart muscles so that the heart can carry out its function for the body. The right coronary artery of the heart, it will branch into the marginal artery and the posterior interventricular artery. Whereas the left coronary artery, it will branch into the circumflex artery and the anterior interventricular artery. Now we're going to look into the physiology of the cardiovascular system, the function of each structure in the heart. So first we're going to look into the pulmonary veins. They are left and right pulmonary veins. They function to carry oxygenated blood from the lungs, the left lung and the right lungs, to the left atrium of the heart. Next, the left atrium, it receives the oxygenated blood from the pulmonary veins, and it will pump this blood to the left ventricle. And after that, left ventricle, it receives the oxygenated blood from left atrium, and it will pump the oxygenated blood again to the aorta. Now, the aorta will then carry the oxygenated blood to all parts of the body, so that the target organ can receive the oxygenated blood to carry out their function. The vena cava, superior and inferior vena cava, they will return the oxygenated blood from the body tissues back into the heart, or more specifically into the right atrium of the heart. And the right atrium receives the oxygenated blood from the vena cava, and it will pump the blood to the right ventricle. The right ventricle will pump the deoxygenated blood that it receives from the right atrium to the pulmonary trunk. And when the pulmonary trunk receives the deoxygenated blood, it will direct the blood to the lungs via the right pulmonary artery and the left pulmonary artery. Now we have learned the function of the heart chambers and also the blood vessels that are connected to each of the heart chamber. Now we are going to look into the circulation that happens within the heart itself. So the heart consists of right coronary artery and left coronary artery. The right coronary artery will branch into posterior coronary artery, which is the posterior interventricular artery, and it will also branch into the marginal artery. So posterior interventricular artery will supply the left ventricle and right ventricle of heart, whereas the marginal artery will supply the right atrium and the right ventricle of the heart. Moving on to the left coronary artery, it will branch into the anterior interventricular artery and also into the circumflex artery. So anterior interventricular artery has the same function as the posterior interventricular artery. It supplies both left and right ventricle, and the circumflex artery will supply the left atrium and left ventricle. So here are some views about the nerve that innervates the cardiovascular system. We can simply say that the heart is innervated by the vagus nerve, which is the parasympathetic one, and it is innervated by the sympathetic nerve. Ladies and gentlemen, moving on to the biochemistry of the heart, we're going to talk about how the heart muscle contract and relax. So it starts when the wave of depolarization spreads along the sarcolemma and T-tubule system, where the impulse is already triggered along the T-tubule system. And what happens? The calcium ion will enter via L-type calcium channel. And when this calcium ion enters, this will further stimulate the release of calcium ion from the sarcoplasmic reticulum. So, this calcium ion will bind to the contractile machinery, which consists of the actin and myosin filament. So once these calcium ions bind to the contractile machinery, this will cause the heart muscles to contract. But after some period of time, the calcium ion will detach from the contractile machinery. And what will happen? This calcium ion, some of them will be reabsorbed back into the sarcoplasmic reticulum. Some of them will be released out through the calcium ion ATPase, and thus the heart will relax. Now we are at the final part of this presentation. We're going to see the diseases that are related to the cardiovascular system, and also the treatment that can be done to treat these diseases. So the first disease is atherosclerosis. But what is atherosclerosis? So atherosclerosis is the condition where there is the thickening of or the stiffening of the artery wall due to the formation of plaque. So the treatment to this disease is we can apply lifestyle changes such as practicing a healthy diet, because sometimes unhealthy diet can cause high level of cholesterol and fat in the blood, which leads to the plaque formation that causes atherosclerosis. Exercising is also important, and medications can be taken to treat atherosclerosis, such as aspirin and ticopidine can be taken as an antiplatelet drug. Next, we have the quite famous disease too, which is the myocardial infarction, or it's also known as heart attack. Heart attack is the condition where the heart muscles or myocardium die due to the lack of oxygen supply from blood. So somehow the blood supply cannot reach the heart muscles to supply oxygen that they need. And that's why atherosclerosis actually can lead to myocardial infarction. So the treatment for heart attack is taking medications such as nitroglycerin and also morphine to relieve the chest pain and to dilate the artery, because the artery is narrowed, maybe the artery is narrowed, causing the blockage of blood. So these drugs can dilate the artery to improve blood flow to the heart muscles. And finally, the surgery, which is the balloon angioplasty, can be done to treat myocardial infarction. Myocardial infarction treatment through balloon angioplasty, it is done by inserting the balloon in the narrowed area of the artery, or coronary artery more specifically, and the balloon will be inflated. This will flatten the plaque, and what will happen? The artery will be widened and the blood flow is improved. That's all for this presentation. Until we meet again, thank you.